Now to some health news this morning. A troubling new study shows the vast majority of American adults are in poor cardiometabolic health. Less than 7% fall into what's considered the healthy category. So what does all this mean? Dr. Ernst von Schwarz, cardiologist, joining us this morning, provides some insight. Good morning, sir. It's good to see you, Dr. von Schwarz. So what is cardiometabolic health?
Well, it's overall an idea, basically, how good our heart, our blood vessels are in the current time. So that particular study you mentioned looked at 55,000 people, and they evaluated glucose levels, blood pressure levels, what we call the metabolic syndrome, and overall cardiac diseases like heart attacks, chest pains, or a history of stents or bypass surgery. And as a summary, basically, less than 7% of US adults have optimized cardiovascular health. So the vast majority has either disease or conditions which will lead to heart diseases like hypertension. Obesity is a big one, of course, diabetes, but also those what we call the pre-hypertension and pre-diabetes, even among children nowadays.
That's a scary number. Only 7% of us consider to be healthy when it comes to our heart. Where does California rank on this national scale?
Little better than the national average. In obesity, for example, national average is at 41%. California has 30% of obese people. Diabetes national average is 11.4. California has 10.2%. Hypertension national average is 30.8%, and California ranks approximately 25%. So among Colorado, Utah, California is among the top 3 healthy states in the US, but we could do much better than that.
What can we do? What can people do to try to get healthier?
EDM, basically, exercise, diet, meds. So exercise is the biggest thing, in my opinion. The recommendation unchanged, 5 times a week, moderate intensity, 30 minutes minimum. Get enough sleep, of course. There was another study a couple of years published which showed if we have too short of a sleep and sit too much in our desks, basically, that increases cardiovascular risk. So exercise, diet, and if needed, then go to your doctor, check your blood pressure, check your sugar levels, your cholesterol levels. And many of us do need medications to normalize them.
The basics right there. A little more sleep, good workout, and eating right can help a lot. Dr. von Schwarz, thanks for joining us.
Thank you, Joe, for having me on.